In this segment, we're getting real about how we can take steps to help protect ourselves from respiratory illnesses. We're so excited to have Pfizer in the building with us today. They're here to break down the latest on vaccines and make sure our community is always in the know because when we look out for each other, everyone wins. So, joining us in the studio today are two powerhouse women doing the real work. First, we have Vanessa McCoy. She's a community engagement specialist from Pfizer right here in the neighborhood. She's out here making sure folks stay informed and connected when it comes to their health. We also have Ranika Alexander Parish, a U.S. Medical Director for Vaccines at Pfizer. She's bringing us the facts straight from the source so we know what's real and what's just noise. We're getting into how to protect ourselves and our people from potentially serious respiratory illnesses like respiratory syncytial virus or RSV, the flu, COVID-19, and pneumococcal pneumonia, which can be especially rough on our older family members. We'll also touch on which vaccines are recommended for adults and why they matter so much. So let's get into it. We want you to leave this conversation feeling a little more informed and a whole lot more empowered to take charge of your health and help the ones you love take steps to protect themselves. So thanks so much for being here, Ranika and Vanessa.
Great. No, thank you so much for having us. And please do call me Nikki. I'm glad to be here to share some important information that can really help protect our families.
Thank you. So, Nikki, could you share a bit more about the immune system and how vaccines can impact your health? Let's begin by exploring one of the respiratory illnesses I mentioned earlier. What exactly is RSV, and why is it so important for eligible adults to get protected? Many people think I'm not sick, so I'm fine. And then there's also some hesitancy around vaccines. That's why it's so important to highlight the real impact they can have.
Great. So sure. So first of all, it's important to know that no matter how healthy you feel, your immune system weakens as you age. So that puts you at risk for contracting a potentially serious respiratory illness. RSV, or respiratory syncytial virus, is a common respiratory virus that spreads easily through droplets when people cough or sneeze or touch surfaces. So for many, it causes mild cold-like symptoms. But for older adults, especially those 75 and older, RSV can lead to more severe illnesses like bronchitis or pneumonia and even hospitalization. There are respiratory vaccines like the RSV vaccines that work by training your immune system to help recognize and fight off infections, and they help prevent serious illness and hospitalizations. I think it's also important to share that according to the American Academy of Family Physicians, RSV leads to approximately 60,000 to 160,000 hospitalizations and 6,000 to 10,000 deaths each year among adults age 65 and older in the United States. It's important to know.
Yes, it is. Thank you for sharing that because I think some people think that RSV just affects babies. So that's definitely good to know. So who should be especially careful when it comes to RSV?
Well, the highest risk groups are adults 60 and older, especially those with chronic conditions like asthma, COPD, heart disease, or diabetes.
Vanessa, how can we do a better job as a community with helping to protect ourselves and our loved ones this upcoming respiratory season? With so many vaccines available, it's important to check which ones you qualify for and which ones are best suited for you. So it can definitely get confusing to know which ones to prioritize.
Great question. So it's important to know that older adults and some adults with underlying health conditions such as asthma, diabetes, or even COPD are at an increased risk for potentially serious illnesses from respiratory diseases like flu, COVID-19, RSV, and pneumococcal pneumonia. So talk to your doctor or pharmacist about which vaccines are right for you. Older adults, however, are at an increased risk for respiratory diseases, which is why helping to protect grandma, grandpa, and your favorite aunties and uncles is so important more than ever. I want to loop back to my colleague Nikki on what the research is showing us on all of this.
Thanks so much, Vanessa. So pneumococcal bacteria, for example, can cause potentially serious lung infections. And in terms of pneumococcal pneumonia, there's some news that the age to get vaccinated has been lowered to 50 or older, even if you're healthy. Now, you're also at risk if you're 19 or older with certain chronic conditions, again, like diabetes, asthma, COPD. And adults age 50 and older are encouraged to talk to their healthcare providers about pneumococcal vaccination. But prioritizing your health, really, that's the key. Staying up to date on vaccinations, practicing wellness, making time for self-care, and incorporating regular exercise are some of the best ways to help protect yourself. And not just during respiratory season, but all year long. It's really about taking small, intentional steps that help add up to a stronger and healthier you.
Wow, I've learned so much today, and all the work you do is so very important, and we definitely appreciate your efforts. Vanessa, where can people go to learn more or to take action?
Well, they can start by speaking with their doctor or their pharmacist. They can review what vaccines might be right for their age or health history. They can also visit vaxassist.com. That's VAXASSIST.com to check eligibility and schedule an appointment for recommended vaccines. Feel free to connect with me at 610-427-9914 or vanessa.l.mccoy@pfizer.com.
Thanks again, Nikki and Vanessa, for your time. This information is incredibly helpful, especially for families who want to protect both their youngest and oldest loved ones.
Wow. Well, thank you. It's always great to be a part of conversations that help our community stay informed and healthy. So thank you again.
Thanks. Now let's shift back to our main segment with Dr. Shabazz.